David, thank you very much for an extremely thought-provoking talk that you have given us this morning. And the actual key nuggets, you've really hit all of the key nuggets very, very saliently this morning. It's absolutely brilliant. I think we have a lot to take home with us and a lot to actually move forward with, and it really focuses us more even. So this morning now, my job and my role here today is to introduce Ann Peat. Ann is a lady, our next speaker, and she's a lady from Rotherham in the UK. Am I right? I'm right. I have it right. Ann is a nurse. She's a midwife. She's a mother of 2 sons and a grandmother of a 7-year-old girl, Isabel, and a 2.5-year-old little fellow called Alex, who keep her very busy. Now, Ann is recently retired, but previously to that, she was the Dean of Nursing and Midwifery at Sheffield, in Sheffield University. And prior to that, she was the Pro-Chancellor of Teaching and Learning in Sheffield College in University overall. And her role there was very much engaging with staff and students to ensure the standards of teaching and learning were upheld, and they were maintained and attained higher standards. She's also a member of the Quality Assurance Agency for Higher Education in the UK, and she's still actively involved in a role there. And again, she's involved in standards and maintaining high standards within teaching and learning and education in the UK within the higher education authorities. Now, since her retirement, she has had a couple of trips. Not a couple of trips. She's just returned from a trip in Hong Kong, where she's been an external advisor there. And she's also got very much involved in a local town, in her local community, in her employment and advisory group there. She's also become a trustee of Rotherham Hospice, and she says it's now time to give something back. That's why she's got herself all involved in those. Now, we've heard John mention about listening this morning. We heard David mention about listening. And Anne is going to continue with that theme as well. She's going to continue and talk about listening. So with a speech entitled, "The Role of Portfolio Enhancing the Link Between Institutions and Clinical Placement," would you please welcome Ann Peat, Emeritus Professor of Sheffield. Thank you.
Well, thank you very much, Henry, for inviting me, and thank you, Caroline, for that very long introduction, and I hope I can live up to all of that, so thank you. First of all, if we look at the slide, you will actually tell my age. That is me, and that's just to give me some credibility. I am a nurse and I am a midwife. You can tell by the uniform how long ago that was. So 45 years ago, plus, I started training as a nurse, and I've enjoyed every minute of it, and I've taken every opportunity I could possibly take to actually extend my career. So I'll talk a little bit about that later, but Henry asked me to talk about the links between what I did as a Pro-Vice-Chancellor for Learning and Teaching and the links between the university and clinical services. He also asked me to give a little bit of an update on e-portfolios in the UK, and to say how portfolios can actually help bring universities and healthcare together in developing something new and worthwhile for the future. So I'm going to try and do all that in 30 minutes. We'll see how it goes. I've got the timer on, so it will ping at an appropriate point, I'm sure. So as the Pro-Vice-Chancellor for Learning and Teaching, I feel very strongly it is important to listen. And this is what we needed to do. And across the university I'm talking about now, it was about listening to what employers said. What do they want from our graduates? Many of us have heard over the years, they say, graduates don't have the skills that we want. So we then need to say to the employers, well, what is it that you want? And it's the same sort of thing that we hear from our health service colleagues, and they say they're not like they used to be. So what is it that is missing? So it is important that we actually listen. We can't actually do this alone, and that's a very important lesson to remember. Now, it was in 1981 that Sir Fred Dainton, he reflected on the university and the NHS interface. And he said it's the place where the future confronts the past. You might want to challenge some of these things, I don't know. But he did say that we needed to have a strategic link between research, education, and health service provision. And he said that was important for the future. It's important to have a learning organisation. We know that change is happening all of the time. So we can't do this alone. We've got to talk to one another. So joint working between universities and hospitals is essential. And there were a number of initiatives undertaken. There were initiatives such as the Joint Medical Advisory Committee, Clinical Academic Careers, and setting up centres that brought biomedical science, medicine, non-medical education together. I have to say a lot of these initiatives were in medicine, but they were initiatives at the time. Actually, it's 35 years ago that he said that, and it seems like yesterday because I can remember it like yesterday. So I think, as educationalists, we have an obligation, and as clinicians, an obligation to ensure that our students in this wonderful hall today, are actually prepared for practice, fit for purpose, and are fit for the award that we're going to give them. So we have that obligation. We have an obligation to work with our professional bodies. And I know, because I heard yesterday about the professional bodies, some of whom are coming and visiting the university in the near future. They look at standards. They help us make sure that the curriculum is fit for purpose. We're in a very unique position, I believe, and much better than other disciplines in the university, because we work with clinical colleagues. Some of those clinical colleagues also are involved part-time academics. We've got clinical coordinators here in the audience, and they're a really significant part of our training. They actually help with curriculum development. They help with teaching. They help with the assessment. So therefore, we're actually engaging employers all the time. I'm not saying we can't do more, we can, but there is that interface already there, and we need to make the most of it. I think in healthcare, as I say, we've had lots of changes, big changes, but expectations are rising all the time. The people out there in the communities want more, they expect more. Globalisation, we know, and I've heard yesterday and I've heard today, of students who graduate from this university going overseas, coming to the UK. We have to prepare students for a global education that we're providing. We know there are great advances in medicine, science, drugs, interventions and technology. So therefore, this obligation that we have is to prepare students to be able to move forward in this changing world. I was reading on the flight over, and it was saying about retail, because we tend to think we're in a little bubble, health, education, but they were talking about retail and the huge changes in retail. Who would have thought there were going to be all these roles that are available now in retail? We wouldn't have thought it a few years ago, and it's the same within healthcare. Who would have thought that we're now going to be talking about different types of professional roles? And we have an obligation, I think, for our patients, towards our patients. How many times do our patients confronted with a different professional coming to ask them about their history? We need to think about this sort of thing. And what I've heard with the ePreP and the competencies, the common competencies, that is really encouraging for me, because it's something I've been talking about for a long time. There's too much separation in our professional roles, and we need to come together a little bit more. I'm always talking about pulling those strings together. And you are in a unique position. You are the future. You're going to be the ones who are going to be pulling those strings together. We know that in order to maintain our credibility, to maintain our skills, we have to have continuing professional development. And I'll come on to that a little bit later. But just a little story, because as good teachers, we always know there's always a little lull and we always fall asleep at certain times, just in case you were falling asleep. I said change happens very quickly. This was my portfolio, if you like. This was my record of practical instruction and experience for the Certificate of General Nursing. It was a tick box. That's all I did. And then it was signed off by someone from practice. I didn't take much notice of this at the time, but my final exam, there was a clinical exam as well, in a practical room. I suppose these days we would call it an OSCE. So I went from section to section. But the final bit of it was there was a doctor and there was a nurse tutor, and they asked me questions from this. Who would have thought this little book was so important? I can tell you one of the things that I had documented in here when I was on a paediatric ward was something called transposition of the great vessels. And guess what they chose to ask me about? Transposition of the great vessels. How do you explain it? I'm afraid I asked for a pen and paper and I drew it. That's the only way I could explain it. But if I'd reflected at the time, I might have been a little bit more informed about what to say to my examiners. That was just a little sideline. Sorry to digress. So going back now to more general, as the Pro-Vice-Chancellor, one of the things that it was important was that we did listen to what the employers were saying. And they were saying, we expect students who are graduating from your university to have a good degree. That was an expectation. But we know employment is very difficult. And there were lots of people with good degrees going for the same job. So what else did the employer want? Well, they wanted some of the softer skills. They wanted to work as part of a team. They wanted the students to be able to work as part of a team, group work. They wanted them to have good communication skills. They wanted them to have good negotiation skills, good professional behaviours, a good understanding of the different subject disciplines. And they wanted students who were committed and motivated. So we took all that on board as a university, and we had a major curriculum change that meant across the whole university, all the departments and 5 faculties, we introduced what was called Achieve More. And it was a module that all students had to undertake. It was compulsory. There were no credits. You can imagine, can't you, what people were thinking, what the academics were thinking, the extra work and mumble, mumble, mumble. what the students were thinking. I'm doing all this and I'm not going to get anything for it. Okay? So huge challenges for us. So just to focus, because this is what this focus is about, on the Faculty of Medicine, Dentistry and Health and what they did. So this is what the students were going to get out of it. It was an opportunity to learn more about what makes people healthy, about how health is unequally distributed. A chance to learn about the teams and how they work, a chance to develop communication and negotiation skills, a chance to work with other disciplines. So in my faculty, it was the student nurses and midwives worked with the medical students and the dental students and human communication science students. So they got to understand the different roles and respect those different roles. So we talk about interdisciplinary working. We need to do this from a very early age. But our students need to see that us who are a little bit longer in the tooth can actually work together with our colleagues as well in that sort of way. I remember quite well being in halls like this and hearing nurses, eminent nurses saying, "Oh, it's those doctors." And I would hear the doctors saying, "Oh, it was those nurses," you know, in a very, not very complimentary way. We've moved on so much since then. We do work as a team, but we need to show our students that we can work as a team. So this is what they did. So in the Faculty of Medicine, Dentistry and Health, they looked at a bus route. And this bus route was very important because it showed huge diversities within the community and huge differences in the health needs of those communities. And the students worked together. They were in smaller groups, somebody from each discipline, and they worked together on certain projects looking at those health needs. And at the end of the module, they then presented their findings to their peers. And they were judged, and the students themselves judged each other, and that was very powerful as well. And so there were little prizes, but there were no credits. Remember, no credits. But we go through life, don't we? We don't always get credit for everything. And so this is preparing them for this learning that is going to be so important for the future. I also want to tell you about what happened in the School of Dentistry. And this was in 2012, and they introduced the ePortfolio. And this was a software developer. He worked alongside academics, some of who were part-time practitioners and employed, so that was employment involvement. He worked alongside students. I can't emphasize working alongside students enough. I feel very strongly that we need to listen to the students' voice. The students are, in my mind, the most powerful. He observed procedures. So a software developer was observing procedures. You could almost say he was training to be a dentist. But he needed to do that in order to see what was needed, what we were saying was needed for this ePortfolio. He prepared staff, he prepared clinical, non-clinical, academics and professional service staff to be able to use this ePortfolio. He prepared the students. There was a pilot before the full rollout across the curriculum. He did say to me that he needed to continue to use the paper copy, the paper record of achievements, as a backup but all the details in that paper copy were not in the e-portfolio. I think it's just a little bit like the comfort blanket, just in case anything gets lost. We still know what experience this student has had. He is ready now to do further development, so that is scheduled for the coming year. The important thing that he told me is that this information in the e-portfolio is current. So if a student was undertaking a procedure, they would put it in their e-portfolio straight away. When we've used a record of experience in the past, we've had to wait until the end of a module, the end of a semester, before a tutor or a supervisor looked at it to see if this student has had all the experience they require for this part of their training. Then if we suddenly found they hadn't, we'd have to send them back to that placement area to get that experience. This avoided all of that. It also means the student is in control. It's the student's portfolio. They're in control of it. They're the ones that are writing it. They had feedback in their portfolio from their academic supervisors and also from their clinical supervisors. And their reflections. So important. Because it's an e-portfolio, they could write as much or as little as they wanted. And they found that from looking at the paper portfolio, there was a small box there for reflection. And so with the e-portfolio, the students were writing much more. And they were also able to go back and add more to it later on. So it really was a good learning tool for them. And it continued to be a learning tool as they had more experience. Now I just want to look a little bit at the UK. And the e-portfolio for nurses and midwives in Scotland. Now, NHS Education for Scotland, NES, and I have a very close colleague who I worked with many years ago, who was involved in this development. And they rolled out a career-long e-portfolio for nurses and midwives across Scotland. But there was wide consultation, and it followed a pilot. And this was really important because it meant that it was what the nurses and midwives needed. It was what the professional bodies said they needed. But remember, it was a career-long e-portfolio. So it's seamless. The portfolio leads them into professional practice and continued professional development. In April of this year, the Nursing and Midwifery Council in the UK introduced revalidation. So many of the nurses and midwives are going to use the e-portfolio that was introduced in Scotland because it's an ideal tool to provide the evidence of the practice hours, the continuing professional development, to the practice-related feedback, and the reflective discussions. The practice-related feedback, and I was really pleased that David mentioned patients, because that can include patient feedback. So we're not just restricting it to professionals. It's the nurse or the midwife's e-portfolio. It's theirs. It belongs to them. The big problem, and if you look at any of the studies about e-portfolios, it's about how it means different things to different people. And I've chatted to a few people today because I think it's important that we understand the purpose of the e-portfolio. If we don't understand the purpose, we don't understand what it's about. It's not introduced correctly, then we have this mismatch of not really sure what we're doing. And that's what, when you're doing something at the beginning like this happens. But we feed it back. We feed back that information so that we are all very clear what the purpose is. So is it, like we have there, a huge pile of papers that we've collected over time? Is it my clinical record of experience? Or is it the electronic ePortfolio? We need that common understanding. So where it's gone wrong, and the studies are very clear about this, is when that isn't in place. So the preparation that we all undertake is crucial. I think you've got the 6 points there. For me, it's an electronic tool. It's to record experience, to record achievements and clinical competency, record abilities, record reflection, record feedback, and record the learning that's taken place. I don't think there's anybody in this room that doesn't sign up to something like that we've just talked about. So it's important that we develop a tool that meets all of our needs. So it has to meet the needs of students. It has to meet the needs of the clinical preceptors, the supervisors and the mentors, the academics, healthcare professionals, and our statutory bodies. Now, it's a tall order, but you've come a long way already, and I am so impressed that you've got common competencies. I just wish we could all achieve that. We want to promote lifelong learners. That's what it's all about. And an ePortfolio should be something that we can use. I heard today students here, pupils, young people, are actually using them in schools. So it should be seamless. The young ones know how to use an ePortfolio from being at school. We use the ePortfolio in higher education, and then we continue to use it as in professional practice. This just gives you a rough idea. 320,000 users of ePortfolios throughout the UK. And we want to extend that further. I was really pleased that David mentioned our friend John Dewey, American psychologist, died in 1952, but he said, and this was the one quote you didn't mention, I was so pleased, David, but we don't learn from experience, we learn from reflecting on experience. Now, reflection is something, again, some of us do well and some of us don't do so well. And again, that is a criticism in some of the studies that have been undertaken. We have to learn how to reflect for it to be meaningful. So that should be part of the preparation. So the ePortfolio then, ideal vehicle to show joint working. All of these people together, pulling all of those threads together, and I've heard about how you're working together already. And that is excellent. I think to do it over so many different universities as well as different disciplines, then you actually come a long way already with the ePreP and the ePortfolio. But remember, Sir Fred Dainton said, joint working between universities and hospitals is essential. We can't ignore that. So we work together. I'm sure you'll be able to recognise some people around this table. You might even be one of those people around the table. But by working together, that doesn't mean to say that we always agree with one another. To improve, we have to challenge. And that's how we move forward, by challenging. We might be called an awkward so-and-so behind closed doors, but we do move things forward by asking the awkward question in the nicest possible way. And together we will achieve the results. And I'm confident that we will achieve the results. It's something I'm passionate about, and I know a lot of you in this room are passionate about it. And what I've heard about the ePreP and the ePortfolio that you've already produced, there's a lot of work already started. And I think you're at the forefront of these developments. And you should perhaps, you need to think about the next step, but you also need to think about sharing it with others. Because sometimes we're so engrossed in what we're doing, with our head down, we think everybody's doing the same. And in fact, that's not the case. So you have come a long way. There's a lot further to go. And, you know, I look forward to hearing more about the future developments. So thank you very much for listening.